like many studies, you can see that whatever has been stated in the result or maybe in the stated in the aims and objectives, then that particular thing, it is all, I mean, we know that insulin is to be given for treating diabetes mellitus in a particular subset. I mean, if you study now that again, that insulin is required for treating this particular subset of diabetes mellitus, then I mean it's redundant study. I mean, you do not require it. It is a well-established clinical fact, well-established current practice, and I mean, if the surgeons want to do something, some paper on particular thing which is not currently available, that particular thing, then it becomes redundant because you are again doing the same study. That is what happens actually many times. You will see the similar kind of paper coming on and on in a particular time frame. Say for a year, you will see only a similar kind of study. Like you have done a study on this hearing loss for RPF personnel. That is something new. Now, if everybody starts doing this in all the RPF, all the police personnel, everybody doing a rifle salute or doing a rifle duty, then it becomes a redundant study. Yes.
I really thank you for it's a very good and illustrative talk, because I believe that especially West Bengal suffers quite a lot as regards publishing is concerned. It is the most backward state. I don't know, I'm talking about my association. We always get hammered for this because very little papers or publications are there from West Bengal. I want you to very shortly tell us a meaning of few terms, because for a long period of time I was also very hazy about these particular terms. Number one, what is a controlled trial? Number two, what is a randomized trial? What is a retrospective study? What is a prospective study? What is a double blind and what is a single blind? These are terms which are very commonly used, and I believe that many in this hall have got several severe confusion regarding this. Very shortly.
Many of the, I mean, as I said, my learned colleagues are here. Dr. Malhotra would possibly give more light to this particular. But anyway, to begin with, single blind and double blind is very obvious. Like, you know, when you are doing a study, if you say you are giving a drug, particular drug to a particular group of patients, and you are looking at the outcome. Now, if somebody is giving the drug, somebody is measuring the parameters, say blood pressure, heart rate, whatever, saturation. I am always giving examples from anesthesiology. And then somebody is noting the results. I mean, somebody is seeing that and then writing down somewhere. So, if that person who is giving the drug to that particular patient is not knowing that, now these patients are again randomized. Who is getting what drug, that person should not know. Who is giving the drug. That this is the group A or B or C. Say there are three groups. Group A is getting this drug that the administrator should not know. That is single blind. And that group A is getting that same drug and giving that result in that monitor is not known by the person who is writing it down. That's a double blind. So I mean, this is the kind, I mean, it may not, this is a common example I am giving, but in surgical side or maybe in medicine things are little different. Medicine this will do, but surgical side maybe there are few, again the drugs, patient and the outcome. These are the three things, and if you consider in this fashion, I think this is the way you can...
double blind, generally the patient doesn't know what he is getting, the doctor doesn't know what
is getting.
Both of
and the person who is writing the result who doesn't know what is being given to which group of patients. That's a double blind.
And I think I can explain prospective and
Prospective and retrospective I think very easy. Like
easy, because
I mean all the meta-analysis or the review articles are retrospective articles, because whatever has been done, it is being analyzed, and prospective is like prospective studies should be in a long-term basis, because prospective studies what happens is if you are trying to see or show something in a large population, say in India, what is the percentage of lung cancer from say smoking or chewing jarda or whatever. Now you have to see for next 15 years that how many patients in this particular hospital or DR Singh hospital or that hospital actually coming up with carcinoma lung, having jarda or chewing gutka, etc. So that is the prospective study.
The
But
greatest example is Birmingham study in cardiology.
yes, Birmingham studies, cardiology, a lot of studies are there. And then what else was there?
Control study. What is a
Control.
control group?
Random control means, I mean, there is a control group. You are having, there is a group which will act as a control group to your study. Like they are not going to get this particular thing, whatever drug or some procedure or something you are going to do to your experimental group, that you are not going to do in the control group. So that will act as a
Basically
control.
for the comparison part.
For the comparison part. Sometimes you may not do it also. Actually, say, like I will again give an example. In the post-operative nausea and vomiting, there are many drugs available now. Sometimes we are giving even decadron also. The steroids have come in a big way to treat post-operative nausea and vomiting. Now we are giving ondansetron, granisetron, palanositron, things like all these drugs have come. So if I want to study a group with ondansetron, a group with palanositron, a group with other some citron, and then another group with steroid, then again I keep a control group with whom I do not give anything. You cannot do this. Ethically you cannot do this because UMB is a known factor and you must give something to the patient. You cannot keep a control in this particular study, which is going to be harmful because many studies have been aborted in between because of this particular problem. That they were not giving anything.